Another common question that we get is related to how COVID has impacted mental health and suicide in particular. One easy way to answer this is, especially around the suicide issue, is we just don't quite know yet. There's been some data coming out initially with COVID that suggested that suicide rates were spiking through the roof. I think as time has passed, what we've seen is that data hasn't been supported across populations. What we do know in the recent report that came out, we're seeing spikes in certain populations. And this won't come as a surprise, but it's these populations that have difficulty accessing care. There might be a stigma related to accessing care. So with African Americans, with individuals who may be marginalized in some sense, not have the same access to services, we're seeing a spike in some of those suicide rates. One of the challenges is the way the CDC collects this data is it's over years and decades, not year to year. So it still will be some time before we have great comparative data to look at. In terms of our overall mental health, I feel like that question answers itself. None of us are doing well. Everyone's struggling. And I think we've seen this across the board increase in frustration. Where that manifests, well, it manifests in our conduct, a lot of civility and citizenship education issues, people becoming quite angry very quickly around mask mandates, frustrations around the vaccine availability, or being asked to do the vaccine when they don't want to. So we're seeing people really get upset more quickly. I think the airlines are a bit of a harbinger if we look at it, like what's to come, like the conflicts we're seeing right now on airlines indicate that people are really not behaving well. And some of that, I think, is very much related to the stress that we're under from COVID.